Every day, liters and liters of fluid is filtered out and reabsorbed back by the systemic blood capillaries, and a small imbalance between the forces which cause outward movement of fluid and the inward movement of fluid will result in life-threatening conditions like pulmonary edema and circulatory shock. Our blood capillaries, they are like a water pipe system which has got areas of leakage and areas of suction. These areas of leakage, they are like those areas from where the filtration is occurring, and the areas of suction, they are analogous to the areas from where the reabsorption is occurring. Today we are going to study the Starling forces which are acting at the arterial end of the capillary and the venous end of capillary, and how the interplay between these forces is responsible for filtration at the arterial end of capillary and reabsorption at the venous end of capillary, and how the disturbances in between these forces will result into conditions which are called as edema, which can happen in case of cardiac failure, renal failure, liver failure, and many other clinical conditions. So first, let's discuss the forces which are acting at the arterial end of the systemic blood capillary. These are four important forces. The first one is blood hydrostatic pressure. This is the same pressure which is actually exerted when heart pumps. So blood when passes through the artery and then arterioles, then this force decreases. And at the arterial end of capillary, which is receiving blood from the arteriole, this force, blood hydrostatic pressure, is 35 millimeter of mercury here. This is an outward force which tend to force the fluid out of the systemic capillary. There is another force which we call as interstitial fluid hydrostatic pressure. Just like we have hydrostatic pressure inside the blood capillary, we also have hydrostatic pressure outside of the capillaries in the spaces which are between the cells. This interstitial fluid hydrostatic pressure is 0 millimeter of mercury. There are two forces which we call as osmotic pressure. One of them is because of plasma proteins in our blood, and this is called as blood colloidal osmotic pressure. Its value is 26 millimeter of mercury. This pressure is because of plasma proteins albumin and globulin. Can you answer in the comment section which plasma protein is most important in exerting the blood colloidal osmotic pressure? Is it albumin or globulin or some other protein? And this force exerted by the plasma protein, this is just like the sponge action which is trying to keep the fluid within the blood capillaries. There is another force which we call as interstitial fluid osmotic pressure. This is because of a little bit of proteins in the interstitial spaces outside of the capillary, which is sucking fluid from the capillaries outside. Because there is very less amount of proteins in our interstitial spaces, because our capillaries they are not too permeable to plasma protein, so that's why the value of this interstitial fluid osmotic pressure is just 1 millimeter of mercury. So you can see here the arrows which are towards outside, they are representing the forces which are causing filtration, and the arrows which are towards inside, they are representing the forces which are causing inward movement of fluid. So what will happen here at the arterial end of capillary? The interplay between outward and inward forces, that will determine the net filtration pressure. So the formula of net filtration pressure is equal to all the outward forces. There are two outward forces here: the blood hydrostatic pressure, which is 35 millimeter of mercury, and interstitial fluid osmotic pressure, which is 1 millimeter of mercury, because of some proteins in the interstitial spaces. So altogether, these outward forces, they are 36 millimeter of mercury at the arterial end of capillary, and the inward forces, major one is blood colloidal osmotic pressure 26, and this force which is 0, interstitial fluid hydrostatic pressure, it is 0, but it can be variable. So you can see here the inward forces are 26 here, outward forces are 36, and the net answer is plus 10 millimeter of mercury. This plus sign is representing net fluid movement is actually outward. So you can see here at the arterial end of capillary, because the hydrostatic forces, this one, the blood hydrostatic pressure, this is much more than the inward force. The major inward force is blood colloidal osmotic pressure. So that's why you can see here the filtration is occurring at the arterial end of the capillary. At the venous end of capillary, all other forces, they remain the same. Just one force changes, and that is blood hydrostatic pressure. It was 35 millimeter of mercury at the arterial end of capillary, and here it becomes 16 millimeter of mercury at the venous end of capillary. See the equation of net filtration pressure at the venous end of capillary. So outward forces, they are 16, blood hydrostatic pressure plus 1 which is interstitial fluid osmotic pressure also here. So altogether these are 17. And inward forces, the major one is blood colloidal osmotic pressure which is 26, and 0 is interstitial fluid hydrostatic pressure. Answer will be 9 millimeter of mercury. So you can see here the sign is minus, which means it will be favoring the reabsorption at the venous end of capillary. So net filtration pressure at the arterial end of capillary, it is plus 10, which is favoring filtration, because the hydrostatic pressure is high here at the arterial end of capillary, so that's causing the fluid to be filtered out. So it is understandable why the fluid should be filtered out at the arterial end of capillary, because we have got cells here, and when fluid is filtered out, so this fluid will be coming out in between the cells in interstitial spaces. So it will bring along the nutrition, oxygen, vitamins, minerals here in the interstitial spaces. And why at the venous end of capillary the fluid should be reabsorbed? It's because it should be taking back the carbon dioxide and the fluid which is extra from the interstitial spaces and the waste products. So in this way, the 90% of the fluid which is filtered from the arterial end of capillary, it will be going back from the venous end of capillaries into the venule, and it will go back into the veins and then back to heart. 10% of fluid which is filtered from the arterial end of capillary is not reabsorbed by the venous end of capillary. So we have studied that 90% of the fluid filtered from the arterial end of capillary will be reabsorbed by the venous end of capillary, but 10% of fluid is not reabsorbed by the venous end of capillary. It's because that contains some proteins that will be reabsorbed by the lymphatic system. It is because lymphatic system has got such capillaries which are more permeable, and those capillaries will be reabsorbing back 10% of the fluid. In this way, all the fluid which is filtered from the arterial end of the systemic capillaries will be going back into the circulation. 90% will be going back through the venous end of the capillaries, and 10% will be reabsorbed by the lymphatic system. So there is an equilibrium that exists between the filtration of fluid and the reabsorption of fluid, and this is called as Starling law. Please mind it that the forces which I am discussing here, they are just for the systemic capillaries. These forces will be slightly different if we talk about the pulmonary capillary, and also these forces will be variable in some other organs, for example kidneys. Another point which I want to mention here is that although the forces are same, but their names, their values and symbols, they are slightly variable in different books of physiology. For example, in Guyton physiology, the symbol which is given to the blood hydrostatic pressure, it is pc. P stands for pressure and C for capillary, and this force which is interstitial fluid hydrostatic pressure over there, this is pressure I for interstitial space. And this blood colloidal osmotic pressure, this is pi c, C for capillaries. And here this is pi I, which is interstitial fluid colloidal osmotic pressure. So I just want to mention here, you need to understand the concept. Please don't be confused by these names of these forces, which are slightly variable in different books. Their symbols and their values can be a little bit different. But the important point which you need to remember is that the major force which is pushing the fluid outward at the arterial end, this is the hydrostatic pressure, which we call as blood hydrostatic pressure, or the pressure in the arterial end of the capillary. And the major force which is sucking the fluid inward is the blood colloidal osmotic pressure. You should know their forces which I have mentioned here. Just memorize the forces given by one book, like these values. Do not be confused by various values and symbols of these forces. And at the venous end, because blood hydrostatic pressure decreases and the colloidal osmotic pressure remains the same, so that's why here at the venous end of capillaries, the net force is actually favoring reabsorption. Now after this comes the most interesting part of this lecture, which is clinical correlations. I'll tell you how the imbalance in the inward and outward Starling forces can result into condition which is called as edema. Edema means excessive accumulation of fluid in the interstitial space. This is a diagram of our circulation, which is representing heart. Blood is coming out along aorta, passing through gradually smaller arteries and then into arterioles. From arterioles, then blood passes into the capillaries. So this is the arterial end of capillary. Here is the venous end of capillary. So fluid is filtered out from the capillaries, and it is also reabsorbed from the capillaries. Because capillaries, they are involved in exchange of material, so that's why capillaries are also called as exchange vessels. Do you know how many types of capillaries we do have in our body? If yes, please mention in the comment section. From the capillaries, then venule starts, then smaller veins, gradually bigger, and then inferior vena cava enters into the right atrium of heart. So there are three types of conditions which can result into edema. This can be because of imbalance of the Starling forces. Either the outward forces can be high or the inward forces can be low. You know that the major outward force at the arterial end of capillary is the blood hydrostatic pressure, and the major inward force is the blood colloidal osmotic pressure. So if there is increase in the outward force or there is decrease in the inward force, this can result in more filtration from the capillaries, resulting into edema. So first we will talk about the renal failure. In case of renal failure, whether it is acute or chronic, what happens, there is retention of sodium and water. So because of that, water level or fluid level increases in our body. Because of that, the blood pressure increases, and when there is more pressure, more will be the fluid here, more will the pressure of that fluid, especially the hydrostatic pressure, and more fluid will be filtered out of capillaries, resulting in edema. So now you understand why those who are having kidney failure, whether acute or chronic, they can have edema. This is because of increase in their outward force, which is blood hydrostatic pressure. Its normal value was 35, but now it will be increased, and that will result in more filtration. Now let's talk about what happens in case of cardiac failure. In case of cardiac failure, because your heart is a weak pump, so the forward pumping will be poor, and blood tends to dam into the heart and then back into the veins. Because of increased pressure backward into the veins, because it's not being pumped properly into the aorta, so the pressure of blood will be high in veins and then back into the venules and then back into the capillaries. Because all this these vessels, they are making a circuit, so when the pressure high in veins, it will be high in venules and also high in capillaries, so that will result in high backward pressure and resulting into filtration. So this is the reason why in case of cardiac failure there is edema. Edema can also occur if there is obstruction of veins. So you can see here, if we put a pressure here in veins, so there will be backward pooling of blood in the capillaries, and that will result in more filtration. So it means pressure in veins will also increase the blood hydrostatic pressure, and this can occur during pregnancy. So I hope you understand why during pregnancy, because there is a fetus inside the uterus that's putting pressure on the abdominal veins, and this is why, because of that pressure, there will be more obstruction here in the veins and backward pooling of blood, hence resulting into more filtration from the capillaries, leading into edema, especially the edema in the lower part of the body, in the legs and in feet. Moreover, whenever there is decrease in venous return, for example, if we are standing for a long time, like barbers, surgeons, guards. So what will happen because of that? Because of leg muscles are not moving, so there will be less blood returning back to heart. One factor that causes venous return back to heart is the contraction of the skeletal muscles in our leg, especially that of calf muscles. So less is the venous return back to heart because of prolonged standing. This will result in backward pooling of blood in the veins, and then high pressure in the capillaries will result into the more filtration. And that's why at the end of the day, if you have been standing for long, you will feel that your feet are swollen. What else? So this decrease in blood clot osmotic pressure will result in decrease in inward force, and this because depends on the plasma proteins albumin and globulin. So whenever these proteins are low, this will result in decrease in inward force, hence more fluid coming out of the capillary. So it will be like less suction force or less sponge like force, which will not be able to keep more fluid inside, rather more fluid will be coming out. So when proteins can be low in our body, it can be in case of nephrotic syndrome. It's a condition in which our kidneys are losing proteins in urine, and protein concentration will decrease in our body, hence more filtration will occur. In case of liver failure, because liver is the major organ which is synthesizing most of the proteins in our body, once again protein concentration will decrease in our blood. In case of burns, because the capillary permeability increases, we are losing more fluid and also more proteins from the capillaries. Normally, because our capillary permeability is very low, so we are not losing proteins, because proteins are bigger particles. And because in case of burns, capillary permeability increases, capillaries become more leaky, more fluid comes out of capillaries, hence we are losing more proteins, resulting in low blood colloidal osmotic pressure and hence more filtration of fluid from the capillaries. Kwashiorkor is a malnutrition condition which can occur in children who are malnourished, especially those who are not taking enough proteins in their diet. Hence, they will have less protein in their blood, having low blood clot osmotic pressure and leading to more filtration of fluid. So I hope you understand, in all these conditions, the imbalance of the Starling forces results in edema, and you, I hope, will be able to answer this question about the mechanism leading to edema in these conditions. And then increase in capillary permeability can also result in edema. Capillary permeability means the capillaries becomes more leaky, and some conditions like allergies can increase the permeability of capillary. Why? Because in case of allergies, there are chemicals which are released in our body like histamine, and those chemicals, they make our capillaries more permeable, more leaky, more fluid will be coming out of capillaries. So that's why when you have skin allergy or maybe generalized allergies, so you see rashes and flares on your skin, and that's because of more fluid leaking out of the capillary. Also in case of burns, because in burns the capillary become more permeable, more fluid will be leaking out of capillaries. And in case of infections as well, because there is inflammation going on during infections. For example, in case of boils, so around boil we see there is swelling, and that swelling is because of inflammation produces a lot of chemical mediators which are vasodilators, so they dilate our vessels, more blood is coming to the capillaries, and more of our capillaries become more leaky. That results into more filtration of fluid into the tissues. And lastly, lymphatic obstruction can also result into edema. We know that whatever fluid is filtered from the capillaries, 90% of that is reabsorbed back into the venous end of capillary. 10% of fluid, because it contains proteins, that does not return back into the venous end of capillaries, rather it is reabsorbed by the lymphatic capillaries. So in those conditions in which lymphatics are obstructed, this 10% fluid will not be going back into the circulation, and this will result in edema. One typical example is breast cancer, because in case of breast cancer, the cancer cells, they drain into the axillary lymph nodes. So those lymphatic vessels which are in the axilla, they may be blocked, or when we do surgery for the breast cancer, once again the lymph nodes are removed, so those lymphatic vessels can be blocked, and this can result into the edema, which may occur in whole the affected arm. This is called as lymph edema, because the lymphatic vessels have been obstructed, or they are not draining the fluid properly from the interstitial spaces. You may heard about a condition which we call as filariasis. This is because of a mosquito bite which transmits a parasite which we call as filaria, and this can obstruct lymphatic vessels, especially in the leg, and then the legs will become swollen, bigger, elephant like, and this condition is called as elephantiasis. Once again, the lymphatic vessels are obstructed, and the fluid will not be drained properly. It will stay in the spaces and resulting into edema like condition, and leg will be swollen. Okay, now in the end, let's have some multiple choice question. First question is, which force is responsible for fluid moving out of capillary at the arterial end? And your options are interstitial fluid oncotic pressure or osmotic pressure, capillary hydrostatic pressure, capillary oncotic pressure, and lymphatic drainage. And the answer to this is B, which is capillary hydrostatic pressure. Another question is, a patient with liver cirrhosis develops ascites. Ascites mean edema within the abdominal cavity. The primary reason for that is increased capillary hydrostatic pressure, increased interstitial oncotic pressure, decreased plasma colloidal osmotic pressure, and D is increased interstitial hydrostatic pressure. The answer to this is C, which is decreased plasma colloidal oncotic pressure, because plasma proteins are decreased in this condition. Next question is, what happens in nephrotic syndrome that leads to generalized edema? And the options are increased capillary oncotic pressure, increased capillary hydrostatic pressure, decreased plasma oncotic pressure, increased lymphatic drainage. So you will be answering this question in the comment section. I hope you like this video. If you find this video useful, you share it with your colleagues who are in medical sciences, dental sciences, or in various allied health sciences. And let me know in comment section which other lecture from the cardiovascular physiology you want me to record for you. Thank you for watching.